cloni. If there is some small spelling mistake probably. Okay, cholangitis. So these are due to adult worms. Coming to diagnosis, eggs and proglatids in stool. So diagnoses are made on if you find eggs and proglatids in the stool. Species identification based on proglottid morphology, Scolex identification, and stool PCR or ELISA. Now, if you comparison of gravid and proglottids, you can see in Tinea saginata and Tinea solium on right hand side. There are more than 12 branches per site of Tinea saginata, and on Tinea solium there are around 10 branches. Treatment, coming to treatment, praziquantel 10 mg per kg body weight, single dose niclosamide, single dose of 4 tablets of 2 grams, given in the morning with empty stomach, chewed and swallowed. Human cysticercosis is an agent, embryonated eggs. So the in agent, host and environment, agent is embryonated eggs. Host is a man, and environmental circumstances unhygienic conditions. Mode of infections are heteroinfections, which leads to ingestion of eggs of Tinea solium and contaminated water or food. Autoinfections leading to regurgitated eggs into the small intestine. Now, this is a cycle of cysticercosis. So that when gravid proglottid enters into the muscles of the animal, the eggs are released, and the eggs the oncospheres hatch in small intestine, and then oncospheres enter to the bloodstream, penetrate tissues, and then it leads to pathology like cysticercosis. Cysticercosis is in muscle, cysticercosis in eye, and cysticercosis in brain. Now, clinical disease. So, in clinical disease, this is a picture of ocular cysticercosis. Neurological deficits depending upon their locations. Okay, so there are neurological deficits that is depending upon their locations. Now, okay. Then there can be hydrocephalus, coma, or death. Okay, this is a picture of hydrocephalus. Then in muscular cysticercosis, these are the pictures. Into small depositions in the bone, in the muscle. Coming to the diagnosis, biopsy whenever possible. Biopsies should be done whenever possible. Physical and radiological evidences. Enzyme linked with immunoglobulins. Serological tests can be as high as 98% sensitive and 100% specific. And then MRI can be done. If you see MRI, you can see here and these some of these patches. Coming to treatment, surgical removal of cysticerca and steroids during the time of neurological symptoms. Praziquantel 50 mg per kg body weight per kg per day in 3 divided doses for 15 days. Albendazole around 400 mg per 400 mg BD with fatty meal of 14 days. 3 months subarachnoid and vascular cysts and anticonvulsants can be taken. This picture depicts global distribution of Taenia solium, cysticercosis and teniasis. Preventive measures are treatment of infected persons, meat inspection, and health education. In meat inspection, beef and pork is adequately cooked. Freezing meat below -5 degrees centigrade for more than 4 days will kill cysticerca. The meat should be routinely inspected for evidences of teniasis and slaughter. At slaughter, proper housing and feeding of pigs and cattle. Coming to health education, washing hands before eating and defecation. Avoid usage of raw sewage for irrigation of posture soil. Prevent the pollution of soil, water, and food with human feces. Okay, this much for prevention and epidemiology. I think we are done with this today's lecture. It finished early. Take your time and read teniasis. It comes as a short note, not full question. And stay safe and have a good day.